From the Toronto Star, I'm Adrian Cheung, and this matters. By now, you've seen videos, read stories, and headlines about anti-Chinese racism and xenophobia directly because of COVID-19. Maybe it's happened to you. We've covered some of those cases for an episode of this podcast. According to an Angus Reid poll, 50% of Chinese Canadians surveyed say they have faced racist taunts and insults since the pandemic began.
Get out of my face! Go back to China where you came from and take your coronavirus back to Wuhan! I'm a Canadian!
But with the focus mostly on racism, what stories are we missing out on? What lessons are we not learning, especially in how underrepresented and often racialized communities get covered in the news? It turns out that while the Chinese diaspora was being mocked and attacked, they were actually ahead of the curve when responding to the outbreak of COVID-19 in Canada, according to researchers from York University. What is now standard practice when we venture out into the world, like wearing a mask, carrying hand sanitizer, temperature checks when we go into some businesses, were being done by some Chinese Canadians before public health officials recommended it. They also found that the trope of Chinese people brought the virus over is not only racist, it's also not true. We're diving deeper into these findings with Toronto Star reporter May Warren, who spoke to the researchers for a story published in the Star. May found a second layer to the stories about xenophobia that we might be missing, and how this moment is one we can learn from. Hey May, thanks for making time to talk about your reporting.
Thanks for having me.
May, you reported on the study, which is led by York University professor Ida Mamuji. What did the study focus on, and what's the goal of it?
So the study was looking at kind of expanding the narrative of the kind of stigma that the Chinese Canadian community in the GTA faced around COVID and the early response. And it also actually looked at a similar community in Nairobi, Kenya. I didn't mention that in the original article, but it also looked at that diaspora and was kind of comparing the responses that they had at the beginning of COVID way back in January and February, some of the stigma and racism that they faced, and how their really early, proactive, ahead of the curve response kind of got lost. The story of that response kind of got lost amid all this kind of racism and stigma. And I think the goal of it was just to kind of tell that story that we really haven't heard before. And hopefully that story can be used to kind of inform for future pandemics, which we will definitely have other ones, so that we can hopefully avoid like stigmatizing minority communities and kind of learn the lessons from what happened here.
And what story does this study tell, especially about how Chinese Canadians and the Chinese diaspora, how they reacted to the pandemic in the early days? What kind of story does this study tell?
Yeah, so here in the GTA, the study authors interviewed like over 80 members of the Chinese Canadian community, and they found that there was a really amazing early response from a lot of them in response to this emerging threat of COVID-19. This is back in January and February when we really didn't know a lot about it, when we didn't know how easily it spread. The science was still out on masks. So they found that, for example, there were some people who were hearing from relatives in mainland China or in Hong Kong just how serious it was. And they were getting masks from them. They were being told you should be wearing these masks all the time in public. There were businesses in Chinatown that were doing temperature checks for employees or requiring masks way ahead of, provincial or city bylaws about masking. Actually, the Chinatown BIA bought a bunch of hand sanitizer stations and distributed them to businesses. And also, I thought it was really interesting, some people in the community were already starting to social distance a bit. They were starting to, stay home maybe from events or stay home from restaurants a little bit. It just because they were kind of already realizing before we even had like a word for it that maybe social distancing was something that they should start to be doing a little bit.
So in addition to the Chinatown BIA with hand sanitizers and trying to get the message out, there were other business leaders as well, right, May?
Yes. So for this story, I talked to the CEO of the TNT supermarket chain, and she talked about how, she could kind of see this coming a little bit. And she was hearing from customers and from staff who were largely in the Chinese Canadian community, that they were very worried. And so this supermarket store was one of the first to require masks for staff. They actually put in travel restrictions for staff, like having to self-isolate at home when they're coming back from impacted countries. And then they were one of the first major retailers to actually require customers to wear masks or face coverings well before bylaws about that were coming up in Canada. So yeah, it was just interesting to see that response from them. And as well, one of the interesting things that the study talks about is that there were some businesses that were seeing a bit of a loss in business in Chinatown, or businesses owned in that community. And some of it was stigma, but some of it was people in the community already saying, I think I'm going to stay home. I think I'm going to maybe not go out to eat. Maybe this isn't the right thing to do at this time, because they were already kind of starting to think about social distancing before that even kind of became a term, and like well before.
Does the study look into why the diaspora was ahead of the curve? I mean, you talked about it a little bit there, but what are some of the key reasons why they were months ahead of what even public health officials were saying?
Yeah, I think there were a few reasons. And one of the things the study also stressed was that, it's a very complex and diverse community. We can't just paint it with the broad brush. Like, there are people with roots in mainland China, but also Hong Kong, Taiwan. So different people were hearing different things. Some of them were hearing from friends and family in China, like, okay, this is a really big deal. You need to start doing these things now. Other people, they were coming from Asian countries where mask wearing was just more culturally accepted, going back to SARS, that threat, and just kind of already embracing mask wearing. Yeah. And then I think there were other people that they were just trying to almost go above and beyond so that they wouldn't kind of be blamed for bringing the virus to Canada, right? Because there was already all of this racism and stigma. And I think they were kind of trying to, show that maybe that they were doing everything they can so that they wouldn't be blamed. And as we know, there were a lot of racist incidents, everything from like microaggressions, looking at people strangely on the bus if they were wearing masks or something, to like outright attacks and people getting yelled at and things for wearing masks. So it was a really difficult environment to be wearing masks, I think, if you were of Asian descent at that time. But people were doing it. And I think it's difficult to say like exactly what impact it has had, but I think definitely they were doing a lot of the right things, and they probably really helped to stop some of the early spread in those early days.
And to your point too, I know that in some East Asian countries like Japan, like South Korea, like parts of China, because they have dealt with outbreaks before and it's just a different mindset for public health, that mask wearing is a lot more prevalent. It was an odd thing for us in the beginning, but they've been doing it for a really long time.
Yeah, and the study talks about that, about how like very early on, there were some members of the community here that were even, I think, sending their kids to school with masks and being told like this is not necessary. And yeah, they were being told even by public health experts at the time, like this is not really necessary. And even there were media stories, even from, reporters here at the Star, and definitely myself at the time, I was like, oh, we don't need a mask, save it for the healthcare workers. Like that was the narrative at the time, but they were right all along, and they were just really ahead of the game.
How did the researchers in your reporting, how do they square these two things? That the Chinese diaspora took precautions a lot earlier than even what public health was recommending at the time, but at the same time, they were facing racial attacks and harassment. Many people in the community were doing the right thing, but how do they square those two things of people doing the right thing, but facing racial attacks? Do they talk about that at all?
Well, they do talk about how, like, in different pandemics over the years, like, it's often that, a minority population will kind of be blamed, like scapegoated for, bringing a disease into a country or a population. And it's something that has happened before. Even if you think about like the HIV crisis, the early days, gay men were being blamed for the virus and being stigmatized, but at the same time, they were warning other people. They were mobilizing to support each other. They were some of the earliest support groups and things like that.
At the same time, something was happening outside hospital walls, on America's streets. As pride parades grew, marches and protests also exploded right along with the AIDS epidemic.
Yet the gay community quickly got the message about AIDS.
So I think that was really going back to like the point of the study, was to kind of learn from this, to tell the full narrative and tell the full story rather than just leave it kind of at those reports of racism and stigma, which are really important, but to kind of get that whole narrative and to show really the capacity of this community and what they were able to do so early on before anyone else.
That's such an interesting term that you use of the full story, because I was reading parts of the study and, I found it really interesting that the study found, and this is perhaps where our responsibilities as reporters and, being in the media comes into play. It said that if we only report about an ethnic group through the lens of them being victims, that's all they ever are. That the view of them is frozen as victims, that people of Asian descent during a pandemic are victims. But as we're saying here with the study, there's so much more to it than that. And the study seemingly says that, we end up missing other lessons that can be learned if we just reduce it down to victimhood.
Yeah, for sure. And it's funny because I remember back in January and February, working on a couple of those stories about racism against the community. And I think they were important for sure, but I think we kind of missed a bit of it at the time. We were okay, so there was racism during SARS. The story now, this angle is racism in the community, which definitely was happening. But we kind of missed that people were trying to warn us a little bit, and there was this other side to it, that mask wearing and that hand sanitizing and all those things. We should have paid a little more attention, and we kind of missed that point. And I think that kind of speaks to, how white Canadian mainstream media is, unfortunately. But I mean, a lot of the experts and the doctors here in Canada kind of were saying the same thing. They were oh, it's a low risk, it's this and that. So I think definitely there's a lot of lessons learned here. And that's why it's such an interesting study to kind of make sure that we try and tell a little bit more of that story and hopefully learn those lessons going forward.
There's another part to your reporting on this story as well, and it's about the context that we're living in and the blame game that's happening.
Mm-hmm. Yeah.
A lot of this can be, attributed to U.S. President Donald Trump, calling this the Wuhan virus or the China virus. He said that again and again. Chinese Canadians and Asians in general, I know I've heard this. We've heard this racist sentiment that, quote, Chinese people brought the virus to Canada, that we are responsible for the virus. There is that sentiment going on. But your reporting also focused on the actual statistics of the cases that were found here. And essentially, that's not true? That's what you're saying?
Yeah, so that was actually drawing on work that colleagues Jennifer Yang, Kate Allen, and Rachel Mendelsohn did, a great piece about looking at how COVID moved in the GTA, how it kind of unfolded. And when you look at the actual statistics from Trump Public Health, which they cited in that story, the cases that are linked to China in the GTA are quite small. I think it's under 5 cases. But there was a lot of cases linked to travel, but it was actually the 2 biggest countries for that were the US and the UK.
That means right now, the US is reporting more than 10 times more positive cases per capita than Canada. And yet no one here is declaring mission accomplished.
So it's just very ironic that here in the GTA, the US was the country where a lot of people with it were coming from. And that was kind of linked to a lot of the early cases. And it really, contradicts this kind of myth that, the virus was brought over from China.
Right. So that at least in the first, 3-4 months of the travel-based cases, they were mostly US and UK based.
Yes. Yeah.
What do you think this research from York University, what do you think the study tells us about how we, and when I say we, I mean society and public health officials, what does it tell us about how we can act in a better and maybe smarter way during infectious disease cases in the future? Because this is what it's ultimately about.
Yeah, I think it's really about listening to different communities and making sure that we're telling more of that full story of their response. And obviously, it just is a very bad public health approach to, be participating in these stereotypes and this very uninformed stigma, which A is wrong and hurtful, but B will prevent you from getting a very important public health message that, maybe we would have paid a little bit better attention to. We should have paid better attention to.
It is striking to me that public health officials could have actually learned from members of the community, especially earlier on. I know that the science was changing a lot and still continues to change around what best practices are, but it seemingly, a big segment of the Canadian population especially in the GTA, they were getting this right in the early days.
Yeah, for sure. And I totally understand the point about the science changing. And I think that was the thing with masks. Like, we were waiting for the science to catch up, and it's a new virus. And that's with everything from this, you're waiting for evidence. But I don't know. I mean, it definitely was very inappropriate to criticize people for wearing masks looking back now in those early days, just because we didn't have the evidence yet. And I think a lot of that was wrapped up with kind of the stigma, unfortunately.
May, thank you so much for your time and your reporting on this.
Thank you.
That's May Warren, Toronto Star reporter, who wrote about the study from York University researchers on how segments of Chinese Canadians and businesses were ahead of the curve, and also what we can learn from different communities during this pandemic. That's it for today. Thanks for listening. This Matters is hosted and produced by me, Adrian Cheung, Saba Aitazaz, and Raju Muthar. Produced and mixed by Sean Pattinen, and our director of programming is JP Fozo. Our show theme music is by So Called, and our episode music is by Mike DeAngelis. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.